Hi, I'm Dr. Ron Samoji.
And I'm Dr. Waqas Jalil.
The purpose of this video is to give you a brief overview of the procedure.
But remember, the most important first step in your surgical journey is a consultation, and we look forward to seeing you then. Breast revision surgery is really just a catch-all term for any patient that's received breast surgery in their lifetime. The most common example of this could be a patient who's received an implant and is now coming back to us after 5, 10, or even 15 years after the implant and looking to have some adjustments or revisions required. In addition to this, patients who receive breast reduction or even breast lift may notice that the dynamic changes that have evolved over time has resulted in some of the breast droopiness or ptosis returning, and as a result they're looking for secondary procedures to help address these issues.
The options for breast revision really depend on what the issue is. In a patient that's had a breast lift or a breast reduction and has a little bit of droopiness that's returned to the breast, the surgery plan can be really quite simple. It can be a revision of this breast lift to tighten up the skin and restore the breast into a more youthful position. In a patient that's had an implant placed or an implant and a lift, things can sometimes be a little bit more complicated. Sometimes there's an issue with the implant itself, such as an implant rupture or capsular contracture that requires exchange of the implant. Sometimes patients are done with their implants and would like to go back to having smaller breasts or maybe are uncomfortable with their implants. In these cases, we plan for removal of the implant and in many cases, or most cases, a revision of the remaining breast tissue. To be more specific, in most cases when we remove an implant, we now need to reshape the remaining breast tissue to provide for a youthful, appropriate shape to the breast without the implant. There are a number of things that we can do in addition to these procedures. Sometimes we'll remove an implant and add some amount of fat from somewhere else in the body to improve the shape. Sometimes we'll add fat in the context of a revision of a lift or a breast reduction if patients have lost a lot of weight and are feeling a little bit deflated. And sometimes we'll even add a new implant in these cases. And so there are so many different options depending on what the issue is that requires revision. The general risks of any surgery include things like bleeding, infection, blood clots, anesthetic complications, some degree of discomfort or pain after surgery, and some downtime, your inability to do some of your normal daily activities or exercise for a period of time.
The specific risks related to breast revision surgery are really dependent on the procedure that you've decided upon. For more information on the risks related to breast revision surgery, please refer to our breast augmentation and breast lift videos.
Recovery from a breast revision surgery really depends on which surgery is performed. This can be a very simple recovery if it's something like skin tightening to improve a lift, or it can be a little bit more involved recovery if we've removed an implant and reshaped the breast. In either case, this type of surgery is generally day surgery, which means that patients go home the same day of surgery. Depending on the type of procedure, we occasionally use drains that come out of the breast and are usually in place for anywhere between 5 days and 15 days. Patients can return to normal basic activities right after surgery, but usually have to refrain from physical activity, heavy lifting, exercise, sports for at least 4 to 6 weeks, again, depending on the type of procedure. In any breast revision surgery, one of the things that's very important is the use of a post-operative bra, and we'll usually tell you how strict that needs to be and how long patients need to wear that for, depending on the type of procedure that is performed.
In this example, we have a patient coming in 10 years after having her original implants in, but unfortunately developing capsular contracture on both of her breasts. After having a detailed discussion with this patient, we elected to not only remove all this previous scar that was present, but also to remove her old implants and exchange them for newer implants, and thus providing her with a natural result. In this example, we have a patient coming in 5 years post having her original implants in under the muscle. As you can see in this photo, the implants have unfortunately bottomed out and the breast fold is no longer holding its structure. After having a detailed discussion with this patient, we have elected to remove her old implants and reinforce her original breast fold. As you can also see in the before photo, the nipple is now positioning more skyward. Therefore, in her breast revisionary procedure, we elected to reinforce her breast fold and exchange her previously old implants for newer implants. In this after photo, you can now see that the breast fold has been nicely restored and the nipple is now in a more aesthetically ideal position.
In summary, breast revision surgery is designed for any patient that has had previous breast surgery, whether it's a lift, a reduction, or implant-based surgery. The type of procedure selected really depends on what the patient's concern is, and that comes out in discussion during consultation.